Hello and welcome to Minutes with the Coach Success in Dentistry mini-series, episode 6. In our last episode, we explored one of the biggest misconceptions in dentistry, and that is that being busy is good. Actually, being busy is not good. Having lots of patients is good, but a tightly filled schedule that has no flexibility or openings in it to serve people actually imprisons you and it frustrates the patients. So we learned how to strategically pre-block our schedule so that anyone in your chair today is able to receive their entire treatment plan within a reasonable short period of time from the time of diagnosis. Now today I'm really excited about our episode. Today is an introductory overview of our next 5 episodes. We will actually explore the concept of becoming a person of influence with your patients. You see, over the years, dental professionals have asked me to help them to raise their case acceptance or to help them to figure out how to get their patients excited about what they can do for them. And in teaching this process, it's become increasingly clear to me that there are 5 interconnected variables that lie at the root of our ability to motivate our patients. So what I've done is I've placed these variables into a model that you can actually visualize and draw from while you're communicating with your customers. And I call this model the influential oral health coaching model. Now, when you fulfill each level of or each of the 5 steps involved in the model, patients tend to take actions. When the 5 steps are not fulfilled, patients tend to resist taking action. So shortly we'll look at the model itself. But first I want to address the whole concept of oral health coaching. I mean, when I use the word coaching, you might think to yourselves, coaching, what is this thing? You know, we're not in sports, we're a medical profession. But if you think about it, a coach is someone who influences people, who inspires them, who motivates them, who leads them, guides them, or directs them towards actions that are in their best interest. And isn't that what our job is in dentistry? In dentistry, no matter what role you play in the office, you are actually an oral health coach. And your job is to help inspire people or motivate them or lead them towards actions that are in their best interest. And human influence, it is my experience, is as complex and as scientific field as the field of dentistry, and it's also as much of an art, and it requires that we become coaches and not just clinicians. So, the first thing that we must do is I think that we must adopt a healthy view of selling. Now, for most clinicians, the concept of selling was not something they signed up for when applying to dental school. In fact, for many clinicians, when they hear the word sales, it conjures up these images into manipulating people into parting from their hard-earned money. I think the underlying mentality is that we're an oral health or medical profession, and because of that, we should simply just be able to tell people what they need, and they should just be able to trust and understand our advice because we represent our medical profession. But I think that this viewpoint can be somewhat self-limiting because our ability to exercise our clinical excellence, our ability to inspire our patients to take action, and to experience optimal health and wellness will rest largely on our ability to be able to inspire our patients to desire what we can do for them. And that is a sales process. So I think the first thing that we must do is that we must actually develop a healthy view of sale, is that we must develop a healthy view of selling. And there's 2 actually definitions that I think we need to look at. The first definition of sales is the old school model. And if we subscribe to this old school model, it will actually limit us in our ability to influence people. And the old school model is that sales is helping people, sales is trying to get someone to buy something that they don't want or need. If that's what you believe, then that will ooze through your pores more loudly than the words you're actually speaking. The second definition of sales, which is a more modern and a more positive one, is that sales is a process of helping people to make decisions that will add to the quality of their lives. Now, isn't that what we do in dentistry? Sales is leadership, and leadership is defined as the art of influencing human behavior. And that's our role in dentistry. Our role is to influence the behavior of our patients so that they can become interested in what we can do for them. All right, now let's look at the model itself. What are the patient influencing variables? What are all the variables that impact our patients and that affect their ability to be influenced, to be inspired, and to become interested in what we can do? So this is a model, and this model is in fact a mental construct that you can use. It's a visual image that we can hold in our minds while we communicate with our customers, and this visual image is a skill that will help us to break down all the patient influencing variables into easy to grasp sub-steps or sub-skills. Now, I've addressed each of these variables, or I'll address each of these variables today, and over the next 5 meetings, we're going to look more deeply at each of the individual variables. So the first one, I think the first step in human influencing is that our patients must basically trust us. There must be a trust. They must trust us, and in order for them to trust us, they must be in relationship with us. Now, I mentioned this to a dentist recently, and I remember his response to me. He said, "Well, Peter, you know, I connect with my patients, but I don't know if I can really do all that fluff stuff." And I thought to myself, well, fluff stuff? What's the fluff stuff? I mean, Starbucks nailed it when they said that Starbucks is not in the coffee business. And I thought, what? Starbucks is not in the coffee business? Well, Starbucks believes that they are not in the coffee business serving people. They believe that they're in the people business providing coffee. Well, isn't the same thing? Isn't it the same for us in dentistry? We're not in the dentistry profession serving people. We're in the people business providing dentistry. We must focus on people more than we focus on dentistry. And Starbucks says that without people, we have nothing. But with people, we have something much bigger than coffee. And that should be the same in dentistry. Without people, we have nothing. But with people, we have something much bigger than dentistry. And I believe that developing deep bonds and healthy relationships with our customers is actually a tribal effort. And the more your customers feel connected to you, the easier it will be for them to buy from you. So the question you need to ask yourselves is what percentage of your interaction with your customers is transactional versus what percentage of your interaction with them is relational. And I think the key, the first step to influencing human behavior is to develop a trusting relationship, and we do this by finding our patients' hearts and developing a relationship with them before we actually try to find their teeth. All right, the second variable in human influence is also trust. But in this case, the trust relates to the patient must actually trust and own the condition that's going on in their mouths, and they need to own it on 2 levels, in the logical zone and in the emotional zone. Patients must trust and own the process that's going on in their mouths. They need to accept the physical details of what's going on and believe that this is true and happening in my mouth. That's in the logical zone. And in the emotional zone, the patients must actually own and trust the quality of life impact this condition will have on their lives. So let's look at the logical zone and ask yourself a question. The next time you're communicating with a customer, ask yourself, whose condition is this? Who's recognizing the condition? Who wants to treat it? And who's dedicated to getting it better? Now, if the answer to any of these questions is you and not the customer, then you do not have patient involvement. We do not, and patient involvement is actually a process of co-diagnosis. Co-diagnosis is the development of a partnership where as a partner in care, your patient actually participates in discovering themselves, in discovering their oral condition, in understanding their oral condition, and then in actually owning what it is that's going on in their mouths. And really what we want to do in dentistry is we want to minimize this expert to novice relationship where we are the expert, take 2 of these and call me in the morning. Trust me, I'm a doctor. Instead of having this sort of relationship, We almost want to equalize it, where we participate in communicating with our customers almost as though we are explorers. Explorers that are embarked on a journey where we are mutually exploring what it is that's going on in your mouth, discovering what's going on in your mouth, and then helping you to make decisions about what you can do in order to alleviate those conditions. So that's the logical zone. Now, in the emotional zone, patients must own the condition, but specifically, they must own the quality of life impact that treating that condition will have on their lives and the quality of life impact of doing nothing. So the bottom line is this. The patients never wake up in the morning and say to themselves, I feel like a crown today. Patients don't buy crowns. They don't buy dentistry. They don't buy the physical details of the dentistry. They buy quality of life. And quality of life is, or value, if you want to look at value, value is the quality of life benefits that your patients will experience long after they've forgotten that you put a crown in their mouths. That's what they buy. And that's what we must convey to our patients rather than overselling the physical details of the dentistry itself. So the first factor in human influence is trust. Patients must have a trusting relationship with us in order to be able to accept our advice. The second factor in human influence is also trust, in that patients must trust and own the condition that's going on in their mouths, the physical details of that condition, and they must own the quality of life impact that condition will have on their lives. Now the third variable in human influence is actually called feeling heard and understood. Let me explain this one. Feeling heard and understood is basically a doorway to touching or inspiring another human being. Think about this. The doorway to another person, right, to another person's heart and mind is actually through your own heart and mind. Now, the old model of sales is that a lot of people, especially in dentistry, they believe that if I want to influence someone, I need to talk. The better I talk or the more I talk, the more I convince people. When in fact in sales, the opposite is true. The more you talk, the less you sell. And I really like this saying. And that saying is that a person convinced against their will is of the same opinion still. Our job is not to try and convince people by talking them or giving them logic. The best way to convince another person is by satisfying their greatest emotional need. And the greatest need of the human soul is a need to feel heard and understood. Every day in every way, when our customers wake up in the morning, they have this emotional social radar. They have this innate desire to feel accepted, heard, and understood by the people they interact with on a daily basis. And our job is to give people the gift of a listening heart. The more we listen to our customers, the more we make them feel that we care, that we're interested, and that we understand what it is that they're telling us, the more they will open up and become more conscious and accepting and curious of what it is that we have to say or what it is that we're offering them. Number 4. The fourth factor, and that's the feeling heard and understood. And I'm sorry I had my slide kind of backwards there. But there we have it. The fourth factor in human influence, I like to call financial value. Patients must perceive that the apparent value of what it is that you're offering them is worth it to them, and they must feel that the financial investment will give them more than they're actually losing. What do I mean by that? Well, patients must feel that spending money on their own dental health will bring them more happiness than it will by spending that money somewhere else on other things that they value. You see, when the issue of money comes up, we must be able to shift the focus towards something other than money. We must be able to help people to see not that they've got to reach into their pocket and spend their money on something. We must help them feel that they're actually investing in something that will have an impact on how they live and feel on a daily basis, and that investment will bring them more happiness than keeping their money and spending it elsewhere. And basically, the four functions or values of dentistry are comfort. They must feel that what we provide will bring them a level of comfort, a level of function, a level of aesthetics, how good they look, and they must feel that this will last for a long time and be worth it within the context of their lives. Also, to influence a person financially, we must develop the skills related to responding to the most common financial questions, and that is, how much will it cost? That's expensive. I can get it cheaper somewhere else. Well, doctor, can I have a discount? Is this covered by my insurance? And I only want what's covered. So in our next episodes, we will actually look more specifically at how to respond to all of those questions. And finally, the last variable to influencing our customers is basically that we need to serve their life story. Patients need to feel that when we are embarked in an oral healthcare relationship with them, they need to feel that we're not just serving dentistry into their mouths. They need to feel that we're serving the dentistry into the story of their life. And what do I mean by that? Well, think about it. When a patient comes into the office, they have a suitcase that's strapped to their arm or a backpack on their back. And that suitcase is filled with everything that's going on in their lives. Patients have a past, a present, and a future, and they're living their lives within the context of their past, present, and future. And there's a difference between good clinical dentistry and good patient care. Good clinical dentistry is served into the mouth of a person, but good patient care is actually served into the life of that human being. And when patients come into our office, they must feel that we're serving their life story and not just their mouths. And their life entails everything from career, family, financial goals, relationships, physical health challenges, everything that's going on into their lives, emotional desires, and our job is to really package a dentistry into their life needs, into their life desires. Now, how do we do this? Well, we do this by creating a more comprehensive chart entry or using our chart as a tool. You see, the traditional chart entry, it contains information like medical data, and it's listed in kind of a clinical or random order, and it's often unreadable. But patients have a story. There's a person attached to their clinical chart entry. And the more we write in the chart about the person attached to the teeth, the more we can use that chart entry the next time they come in and the next time they come in, so that we're actually treating them within the context of their story. And there you have it. So remember, no matter what role you play in the practice, no matter who you are or what role you play in the practice, at the end of the day, you are an oral health coach. And in order to be able to serve our customers or our patients, we must be able to inspire them to take actions that are in their best interests or in their best oral health opportunities. And this requires that we influence or inspire our patients. But rarely is influencing another person a job of straightforward persuasion or simply saying the right thing. I mean, learning scripts or generic scripts will not help you to influence another person. Influencing another person is better described as an effort to create conditions for change. So the oral health coaching model is actually a mental construct of human needs that must be fulfilled in order to enable our customers to reflect, to decide, and to act on their best interests. Our interactions with our patients must facilitate a synthesis of ideas that allows people to tap into their own hearts and into their own minds and to come to desired conclusions within their own mind. So the next time you're conducting a treatment consultation or an examination at any level with a patient, ask yourself a question. Have I fulfilled each step of the model, and at which level At what level am I fulfilling each step of the model? Have I adopted a healthy view of selling or a healthy approach to selling? Does this patient actually trust me and feel connected to me? Does this patient trust and understand and own their actual condition? And do they understand how their condition will impact their quality of life? Does this person feel heard and understood in my presence? Do they feel that spending their money on dentistry, is actually worth it? And do they feel that their life story is being served, or do they just feel that we're trying to stick dentistry into their mouths? So over the next 5 episodes, we're going to look individually at each of the 5 human influencing variables, and I'll give you some tips and strategies for taking your treatment acceptance to the next level. To learn more, please feel free to call me, and on behalf of myself, Peter Barry, and the Halton Peel Dental Association, we look forward to seeing you next month. Have a happy holidays, and I look forward to our next episode. Thank you.